name's Jess Wilson. I predominantly work in the independent health sector in Elysium Healthcare, but I've been seconded one day a week to an Iron Bevan to introduce storytelling to the patients and staff of the mental health and learning disability. So I've been working and using storytelling for the past 10 years in a medium secure setting, and the nurses who have been taught to use storytelling in that setting have said that it helps them engage with patients in a meaningful way. They found it a beneficial tool, if you like, to bridge the gap between care and security, because it's a very juxtaposition that nurses work in. On the one hand, they've got the keys and preventing patients from leaving the ward, but on the other hand, they're also being asked to be caring and nurturing to those patients. So when you're telling a story, and when I say storytelling, I'm talking about stories from the oral tradition, all that's happening in that moment is you're telling a story, and it gives the patient an opportunity to think about something different.
Hi, my name is Zoe Evans. I'm a staff nurse on the Neuro Rehabilitation Ward in Neath Talbot Hospital. We care for patients who have acquired a brain injury.
The patients that we look after can be there for long term, and they're not necessarily ill, so boredom can become a real factor. So we implemented the art scheme, and it's really made a difference.
Part of the art project was art abandonment that Helen implemented on our ward. So Helen explained what art abandonment was, and we worked together as a team, the staff, therapists, and we worked with the patients. Patients then decorated pebbles, and we put a little note with the pebbles, and then we hid them around the hospital. Patients came with us as well to hide some of the art. And then there was a little note. You could either keep the art once you found it, pass it on, or just leave it there for somebody else to find.
So my name's Carol and this is Rob, and we work with the brain injury team in Morriston Hospital, community-based rehabilitation team for people who've had brain injuries. And this is Heather Pennell, and she's working with capital planning. So the way we work in the traumatic brain injury service and the brain injury services, we want to use our service users to tell us what they want, what they need, what are they going to get out of it. So having this little bit of money, which we were then able to match fund, meant that we were able to get them to be involved in the art, to be able to actually put their art on the wall, so that it had meaning for them. So when they come into the unit, they see their art, so their little bit of porcelain, they can say to whoever it is, that's my little bit of porcelain there, and it's really important and it's beautiful.
Yeah, it's ownership basically, isn't it, of what we were doing, and they got a lot out of it as well.